You are now tuned in to the number one nursing podcast in the world, the Scrub Me In Podcast by Nurse Junior and Anthony.
You are now tuned in to the number one nursing podcast in the world, the Scrub Me In Podcast by Nurse Junior and
Nurse Anthony.
Welcome. This is episode 21.
Let's go.
Make sure y'all like, subscribe, comment on YouTube. Follow us on TikTok, Instagram, Facebook, all that. Tell a friend, tell another friend.
To tell another friend.
Yes. So we got a special guest on the line.
Yes, sir.
How about you introduce yourself to the scrubbers, is like what we call them.
Hey, y'all. I'm Dr. Tariq, Hanzla Tariq. I emergency doc. I work in out of the Toronto area in a place that I've been working there since I actually graduated. So I'm excited to kind of jump on this podcast and see how I can share some of my experiences, my ups and downs, and hopefully inspire, motivate, encourage, or maybe just steer people clear from this if that's not their thing.
Oh, that's funny.
So yes, you said you're a medical doctor. You work specifically in what specialty?
I'm in emergency medicine, so in the emergency department.
Okay. How long have you been in the emergency department for?
I just actually crossed my 10-year mark in the summer, so I'm over 10 years now.
Hey, congratulations, man.
Yeah, congrats on that.
Yeah,
congrats on that.
Thank
So
you,
all 10 years you've been in emergency medicine?
Yeah, exactly, from day one, yeah.
Oh, man.
Okay.
Yeah, that's dope. So just for any people that are kind of out there and not in healthcare and kind of thinking about maybe following similar paths as you, can you just kind of tell them the schooling you've been through, what they need, and kind of from university and onward, what that looks like? Yeah,
for sure. This is a thing that actually turns a lot of people away from it. It's turned me away from it, actually. You're like, I don't want to be in school my whole life, especially when you're a teenager in high school. You're like done with school.
Absolutely.
And the last thing you want to hear is that, you got to do another 10 years. That's what I heard, right? You got to do another 10 years of school before you become a doctor. You're like, what? No money? No fun? 10 more years? That's a nightmare, right? And so for any young person, they're just like, nah, I'm that's not for me, right? But I'm going to tell you something. And I'm going to tell you my story in the sense that it only took me 2 more years, okay?
Yeah.
2 more years. And when I say 2 more years, I mean 2 more years than what everybody's already doing.
Wow.
What is everybody doing? They're going to college, or they're going to uni, or they're going to some certificate program or apprenticeship. They're spending 4 years doing something, give or take.
Yeah.
So what I did it in 2 more years than that, and I have a lifetime to appreciate and be grateful for that. Fortunate decision. So I got to give credit actually right off the bat. This me becoming a doctor was my mom basically stiff-arming me, putting me in a Kimura, and me tapping out to her. She went on like a hunger protest when I said
Oh, that's funny.
Yeah, exactly. So she went all out. She knew me, right? I'm a son, and I was young. She knew how to play me, and I got played, and I'm so grateful I did.
Yeah,
exactly.
I'm sure. That's the best playing you could ever get, man.
Yeah.
Shout out to moms.
Man. So, yeah, exactly. So I say all of this from that point of view. So anyways, I did my high school, finished, hit grade 12, and then I went into York. So this is where it was. I was thinking of doing chemistry, do 1 year chemistry, apply for pharmacy school, do 4 years of pharmacy, and then I can open a Shoppers Drug Mart. I can be a pharmacist and make 100 G's a year, and I'm good. Like, have a little business there, have a pharmacy pay. I'm good. 5 years, and let's go. I don't want to do 10 years. And my mom's like, 10 years. So that's where it all started. So then I was like, you know what? Okay, fine. When she convinced me, I was like, okay, I don't care about my undergrad. I really don't care about my undergrad because I really want the graduate degree, which is the medical degree, MD.
Yeah.
Right.
And so I was like, what's going to help me to kind of get to that in the best position? And I found, there was factors that made me choose York because I had a family business that I was helping with. I couldn't go away, couldn't afford it, all that stuff. So I had to stay sort of local. So that was my main option, that or U of T. I ended up choosing kinesiology, which is a study of motion and movement of the body, which was perfect. Highly recommend that. Even nursing, I think, is an excellent undergraduate for anyone that wants to do nursing or even the other areas off of that in healthcare. So the kinesiology degree is a 4-year degree, and I just loved it. I can't emphasize to people enough to stay away from like life sciences or like biochemistry relative to kinesiology. I'm not necessarily studying like plant cell wall, and the microorganisms, whereas I'm focusing more on the anatomy, physiology, psychology, human nutrition, things we can touch, feel, see. It's a lot easier to understand these concepts than like, endoplasmic reticulum. Like what? It's just ridiculous.
Yeah, if you didn't know, the mitochondria is the powerhouse of the cell. Yeah. So that's a big thing.
Yeah. Exactly.
That's hilarious.
Exactly. So, since day one, I was like, I'm going to do this thing as fast as I can because I don't want to do 10 years. So I started gearing up to get into med school in minimum time. So I found out the minimum is 3 years of undergrad. You don't even have to finish the fourth. I said, okay, let's do that. Yeah. So I started like gearing up for MCAT and doing everything by the second year. I was just focused. Honestly, that's what, and because that was my end goal, to get done with this education as fast as I could. So fortunately, through my mom's prayers and, commitment to like sacrificing whatever it took to make it possible for me, I was able to get into Mac Med School in Hamilton. After
nice. That's awesome.
After my third year. Yeah, blessed. So, what's crazy, and again, I gotta give a shout out to mom. Like my mom, she used to pray like 2 units of prayer like every night, asking God, make my son a doctor.
Yeah.
So when I got the news, I gave her a call, and the only thing I told her, I was like, Ma, you can stop praying those 2 units now. And she just like she instantly got it. Right? She screamed, and she's like, no, reflex. I'm gonna pray 2 units of gratitude every day.
Let's
now.
go. Yes. Mom knows what's good.
So anyhow, again, just saying this because these are the things that made it possible for real.
Absolutely.
So 3 years of undergraduate New York kinesiology, got into Mac Med School. Amazing. Why? It's also 3 years, not 4 years. So I've already shaved off 2 years.
That's right.
They don't take summers off. Summers are 4 months. After 3 years, you got a year of saved, time. Now, in retrospect, I wouldn't really recommend that. When you're young, you need some more time. You need time to relax, play. You need some time off. You need time to stretch.
Yeah.
And so this was a bit hectic, especially in med school. And that's where we'll get into some of the advice specific to that. And later on. But so we did 3 years of York, 3 years of McMaster Med School. And after you do med school, you need to pick a specialty for your practice. And so, again, I was like, what's the quickest? So then I found family medicine, 2 years. Okay. So I was like, started doing family medicine. But before I graduated, I had like an existential crisis. I was like, man, this is too easy for me, I was like, I'm not stressed. This is kind of like too easy. I'm not even done yet. And I'm like, kind of just like, kind of bored. And,
that's the best kind of crisis to have, Hanzla.
Right. Yeah.
Yeah. I was like, man, I can't be doing this for the rest of my life. I'm not even done training and I'm feeling this way. I was like, shoot, what am I going to do? And I'm like, okay, what's the hardest thing I can do right from here? And it was like, because in family medicine, when I didn't know something, I'd walk out of the room, go to a computer, check it, and come back and pretend like I knew it.
Right.
But I was like, what's something where I need to know everything on the top of my head? And at that moment, I was like, that's emergency medicine. There ain't no time to look it up.
Yeah.
So I was like, okay, all right. So then in Canada, there's that 1 year fellowship that you do on top of family medicine, and that gives you like a dual designation, family and emerge.
Right.
And so I applied for that, and I was fortunate to get that at Ottawa. So I did, again, so it's 3 years of undergrad at York, 3 years of med school at Mac, 2 years of family medicine at Mac, 1 year of emergency fellowship at Ottawa. Yeah, so that puts us at 9 years after high school. But the reason why I say I did it in 2 years more is that for 3 of those years, three of those years getting paid. So as a resident, you're getting paid at least $50,000, $60,000. So you can't be mad at that. That's how much I would have got paid if I didn't try to go to school anyway.
Absolutely.
Right, definitely.
Right. So that helped me mentally to be like, okay, it's not all just school. I'm getting paid while I'm in school.
Right.
And so that's where I go 9 minus those 3 years of getting paid. That's 6 years. 6 years is two more than what most people, typically go to school for anyway.
Yeah, that's right. Wow, that's amazing.
Yeah.
That's great.
So you pretty much answered the next question I was going to ask. So I'm going to go into 4. How do you think emergency medicine differs from other medical specialties in terms of challenges and rewards? I know you mentioned how, in emergency medicine, you have to know the knowledge right then and there. So can you go into depth a little bit on that, as well as the challenges and the rewards?
Yeah, so I think with Emerge, I love the feeling of actually feeling like I'm a real doctor. Like when you think, okay, a doctor, like basically any health problem, you're like, you need to see a doctor, and an emergency medicine can actually be that doctor.
Yeah.
No, I'm not trying to put other specialties down. Each have their, play and role, but you're not going to insert any specialist to take care of any particular emergency, right? And so I love that fact. Like, on a plane, like oftentimes there'll be like 3 different doctors, and as soon as they find out I'm the emerge doc, everyone just runs away. They're like, okay, yeah, I ain't got nothing on you. The thing is the challenge, right? Like if you're not growing, what are you doing, right? And so Absolutely. This is the thing about like if your work is stimulating, it just helps to kind of keep it interesting, keeps you on your edge, and keeps life interesting. The thing about Emerge is that, and the first couple of years, like I like popped ulcers in my stomach with the stress, working night shifts. Like, what if something comes in that I can't do it?
Right.
But it's one of those things that I remember hearing on a podcast. It was kind of like, you don't rise up to the challenge. You don't rise up to the challenge. It's like, no, you don't. So it's like you fall back on your training. It's like, wow.
Yeah.
Oh, that was an enlightening moment for me to be like, okay, so you know what? I don't have to be a superhero. Just have to be solid on my foundation.
Right.
So that's what I focused in on. I was like, you know what? Somebody has to do this job. I want to be the best chance that they have if they have a problem. No one is perfect. Everyone's going to struggle. But I want to put myself in a position that if someone gets into is a motorcycle accident and goes flying across, the road, I want to be the best chance that they have to survive. It's not coming from a place of arrogance, but it's coming from a place of like falling back on my training. Somebody's got to do it. Somebody's got to take care of that, child that may not be doing well and parents are crying and upset. Somebody's got to do it. So, I figure I put myself in that place to be like, you know what? I don't wish that on anyone, but if it happens to anyone, I want to be the best chance they got. So that motivates me and challenges me to want to, be that. And you were saying some of the challenges as well, right?
Correct. Yeah.
So it's, there are some, and I think that thanks for asking that, because there are some tough things. Like this part of it is all exciting, but shift work is not easy on the body, and you know that, right? Like our sleep schedules. There's research associated with some sort of cognitive declines that's happening if you sort of stay up all night and through sunrise. It's hard to have a routine. Like, the people that are like, oh, every day I wake up at 5 a.m. and I run, or I go to the gym, or I swim. It's like, that's not a life that we can really get used to, because our circadian rhythm is like always thrown off. And then like when people are like, oh, long weekend's coming, and I'm like, oh yeah, well, guess what? I'm working again, because somehow I'm working every holiday,
exactly.
Or the weekend. So that I'm willing to sacrifice that just because of everything else that the job gives me, the flexibility of getting days off. However, much more flexibly than other specialties. There's the challenges of, seeing the child that's sick, that's intense social trauma. Like, I don't know a better word to say it, but when I have these conversations with family members or parents of a child that's died, like, man, it's actually harder to, decontaminate, I don't know, like detoxify from that really, really painful conversation, having to absorb all that guilt, absorb all of that anger, all that sadness that they throw out there, and you're sort of that rock for them to try and answer the questions, to try and like re- reassure them, but also at the same time reiterate to them that the person that they love, the child, the loved one, is dead,
Yeah.
and it's like you have to kind of be a robot because and absorb all that. And then where does that go? It's just kind of stuck in you, but you have to find healthy ways to outlet that.
For sure.
And so that's a real challenge. And that's if we don't address that and we don't take care of each other and we don't recognize that early on and throughout our careers, risk of burnout and risk of actually us getting sick goes up exponentially. So yeah, these are the real challenges of working in this kind of high stress environment.
Yeah, man, I could absolutely see that. And I mean, for my next question, you kind of touched on it when you referred to shift work. So I know you kind of have that dual specialty where you can work emerge and you have family medicine behind you. It's kind of a dual part question. One, do you have like a family practice that you work out of as well? And two, in terms of your shift work, what does your schedule look like? Do you work 12s? Do you work 16s? Do you work 7 days in a row? What
Yeah,
does it usually look like for
yeah,
you?
yeah. That's good. Thanks for asking that. So I do just emerge. I love emerge. I just can't get myself to do anything but that. I
Yeah.
can't sit in meetings. It's just like everything else seems so boring. It's like it's like driving a race car and then you put on a regular car. You're just like
Yeah, yeah.
I can't. It doesn't feel the same. Um, but I want to make it very clear. Like people think, oh, doctors have this like crazy, like they work all these hours. It's true and it's not true. It's true in training. It
Yeah.
is true in training. You don't own your life in training.
Yeah.
But after you graduate, there is sanity. There is, a normalcy to it.
Oh, for
And
sure.
yeah, and so when it comes to like the hours, like for me, there is no like scheduled breaks, for example, right? So we have 7, 8, 9 hour shifts, kind of. They go, say 7 to 10 hours. There isn't a fixed like you punch in and punch out.
Hmm.
It's kind of this time frame, but then you have you go overtime, just tying up loose ends and dispositioning patients. So um, yeah, so and then the thing is, it's hard to justify when someone's coming in renal colic or like screaming in pain to be like, you know what, I'm kind of hungry right now. I'm gonna go for my lunch and then I'm gonna have my coffee, and then I'll get to you after that, right?
Yeah,
And,
absolutely.
and it's always something, right? It's always somebody who's waiting. It's always somebody who's tired or in pain, and it's just hard to justify that. So that's why with these shifts, they're kind of like intensely on and then intensely off
Yeah.
rather than long shifts with breaks type of thing, even though there's overlap.
Yeah, yeah.
Now, the schedule is like the highlight. It's the highlight of the specialty. There's no one that's waiting to see me particularly. It's not like they're my patients.
Yeah, that's right.
Um, so if I'm not there, they're not upset. Someone else will fill my shoes.
Right.
And so from that point of view, the full-time schedule from Emerge workload is not like 5 days a week. That's not considered full-time in Emerge. In Emerge, is more like 3, 4 days a week is considered full-time because of the shift work and the having to kind of turn your days over regularly. And
Right.
so, and that just that's one that's great. You have these unusual days off, allows you to sort of do things and recharge, especially when everyone else is not off. You know about that as well.
Of course.
And
Yeah.
and then in terms of like time off, in terms of time off, it's also for me. I think every shop has a different setup, but it's like um, being able to not be restricted to like the 6 week a year setup, at least in Canada, which is amazing. Really allows you to kind of prioritize things outside of medicine. So can make time for them, and so that's been such a valuable part of doing emergency medicine, especially in Canada. I imagine it differs, and so everything I speak to is like really unique to maybe my hospital, but definitely to Ontario and Canada.
Yeah.
Okay. So the next question I want to ask was, let's go back to prior to you becoming a medical doctor. Talk to us a little bit about high school. As a teenager, was it set in your mind that you wanted to become a doctor, or did you have another profession in mind?
Yeah, I had no idea. It was kind of like just going with the flow. In high school, it was just about friends and fun. And actually, it was a telling moment because I always thought I was like, I'm pretty good at school. It comes kind of easy to me.
Yeah.
But in grade 11, I got called to the VP. My physics teacher put me on like probation because I was like failing the class. I don't know. I had too many skips, or like it was bad news. I was just like, I got shook up. I'm like, man, like, am I just making an excuse for myself, telling myself that I could do it if I tried, so I'm not going to try, but I'm
Right.
smart, but I'm not going to try?
Right.
Or is it that I'm not actually able to do it and I'm just making excuses, right? So I was like, which one is it? And so, that I'm so grateful, to that teacher that did that. And that he made me. It was like a moment where I had to make a shift, and this is grade 11, and I was like, and this is like pre-midterm, and I was like, okay, you know what? Let me see what I'm made out of, right? So then I focused. I attended my classes. I worked hard. I studied hard, and so by the end of grade 11, amazing. They bell curved at that time, so these marks are going to tell you I got better than I probably scored, but the bell curve did. So in chemistry, bio, physics, I got 94, 94, 94, and in calculus, I think I got 90, and got like 2-3 awards that year. And this is not, this is something that I picked up in the middle of that year, but it was just, again, I had to be real with myself and I was fortunate to get draped up like that and shook up like that to be like, like, are you real or are you just pretending?
Yeah, that's right.
And actually, I'm glad that I was 16 at that time. I'm glad that I experienced that, and then that challenge and experienced that success. Successes when you're younger are easier than successes when you're older, and so every success counts. It's kind of like a chip on your shoulder. It's kind of a step that you take up and you build on and you feel confident from. And so that was what set me up to be able to apply. But I didn't know, and it was that story I told you about my mom kind of like, pigeonholing me into medicine.
Okay. See, that's nice. So, and then going from high school and then into university. Now, I know you said you were super focused when you were there and kind of figuring out how you can do things in the shortest amount of time. Outside of school, did you ever have any like extracurriculars or anything you were volunteering in just to kind of keep you? I mean, you were still a kid, right? So keep you young and moving,
exactly. Yeah. So, man, this is the challenge. Like in high school, I actually my high school had a coach who was an Olympic wrestler. He was like medalist, right? So I was like, man, and I thought that martial arts and wrestling was cool. So, I did did that for a couple of weeks, but it was taking up like you're conditioning 5 days a week. You'd practice 2 hours. Like you go home exhausted. There's no time to study. There's no time to do any other volunteer work. You're just beat physically, right? And so that's an example of sacrifices that you have to make, in order to, really make a dream come true. It has to be a dream. Dreams are things that you work really hard towards, or else they wouldn't be called that, right? And we have different dreams in different aspects of our life, but a career is also often is a dream for many people. Some people want to be, for example, like athletes or NBA players or other things, actors. These are hard things to get into, but they're not impossible. It's just, and that's what I want to just allude to is that it does take sacrifice. It does take commitment to it, and it takes just staying focused on it and not wavering back and forth. Like, do I really want to do it? It's like, no. Once I made that decision that I'm gonna get through this as fast as I can, I never changed my mind about it. Thankfully, thank God.
Yeah.
Like, I just stayed focused. Like, okay, I'm gonna do it. I'm gonna find my way. I'm gonna find the way. I'm gonna find the way. It was just like, just find the way. It wasn't a back out. It wasn't give up. It was find the way.
Yeah.
And so what was the outs? Well, first let me tell you about what wasn't the outside. It was like all these like volunteering that I had to do to kind of juice up the application.
Right.
In terms of like the med schools seeing, okay, this guy's, he's serious. And so, I wanted to learn. I'm a young, at this time you're 18, 19, you have no life experience. So I was like, okay, I want to be put into positions where I have to get life experience. And that's where volunteering, I highly encourage people to take advantage of that. Honestly, it was transformational for me because I put myself on boards. You kind of see how executive people think, and I'm just sitting there quietly. I have nothing to add, but I was fortunate that they even put me on there. I just went with the angle that I provide a youth perspective, whatever that was worth.
Hey, it's worth something, man.
Yeah, and again, everyone on there was like a couple decades older, so they ran with it. They're like, yeah, this is good for our diversity. So even back then, it was good.
There you go.
So I was on a couple of boards, I went on committees, but that stuff was dry. And I was like, you know what? Okay, I got it. I understand meetings. I understand the process, book governance, etc. Then I was like, you know what? I volunteered at a hospital. They gave me a list and said, here, go deliver these cups of water. I was like, this is a waste of life.
Cups of water.
Oh, that's funny.
Right? I'm like, this is a waste of life. I don't want this on my resume. What am I going to write? Efficiently delivered cups of water to patients.
That's
like,
right.
You can't make it sound any better than that.
Oh man.
So I was like, I need to take this opportunity to strengthen my weaknesses. And I'm kind of an introvert, kind of a shy, kind of a mumble when I talk type of person, rather than a loud center of attention. So I recognized that, and I said that's something I need to work on. So, and I was kind of shy with class presentations and all of this. I'm like, you know what? I'm a volunteer where I have to give public speeches, because if I screw up, I can just quit and never show up, and it's okay.
Yeah.
Right. So I went with that out. And I started doing these things where I ended up having to make some talks, not all that frequently, but not infrequently either. It distressed the crap out of me. My voice would be shaking, my knees would be shaking. I'd be like, going to the washroom 10 times in the last minute, and but I think that really, that adversity helped me grow, and so that was, again, this is all part of the work and the commitment that goes into it. As far as the outs are concerned, the decompression, I'm so grateful for my network, my social group, my support, my friends, that when I'd be connecting with them, there was no school talk, there's no work talk, it was just laughing, it was just good times, it was just positivity. They didn't inject negativity, it was always just positivity. I was so fortunate to have that in my life, where I could just call them and boom, escape immediately. The thing was, though, that had to be sort of scheduled in. It had to be at the end of my day, after I've studied, after I've volunteered, and I had to kind of be reasonable. Not always. Sometimes you have these all-nighters you spend, but most of the time it was kind of like 3 hours, 4 hours. Okay, after this, it's the benefits kind of tapering out. My next day is full. And so you kind of try to do the best you can. I'm probably making it sound like I was a little more, goal oriented than I truly was. I probably survived on like 4 hours of sleep just because, friends matter. And, but I was really, really, really fortunate to have that in my high school, university time as a outlet.
That's great. Okay. So, next question from me specifically is, what high school did you go to? Were you at a private school, public school?
Everything. All my education was public. My parents, immigrant family, working two jobs each, hardly seeing them,
Wow.
And I went to a high school in Brampton and Turner Fenton,
Okay.
Fields and Kennedy. Yeah.
Okay. Okay. The reason why I asked is because how I met Hanzla, and I was telling you a little bit about this, Anthony.
Yeah.
We were playing basketball a while back. Hansla's mid range, my goodness.
Yo, Hanzla, I heard you're a hooper, man.
He was hooping,
I heard you're a
man.
hooper.
Transition, layups. I'm like, dang, this guy's a tough guard, tough matchup.
Ah, that's funny.
I'm glad you got that on record.
Yeah, man. Now we know what you were doing with your extracurriculars.
Yeah,
you know?
definitely.
Yeah.
You see, you're hiding the fact that you're a hooper to people, but they don't know. I'm sure you're in the emergency room. You probably got some Jordans on,
Yeah.
just ready. You can save a life, but you can cross a motherfucker up too if you need to. Like,
Shorts on underneath, ready to go.
Always ready
At all
to go.
times.
Always, you got a jersey under those scrubs. You know what I'm saying? I see how you're moving, Hanzla.
So,
Yeah, man.
the next question I want to ask besides that was, what were some of the biggest challenges you faced during medical school? How did you stay motivated through the long hours of studying and training? Were there any moments where you doubted your path? And how did you overcome these feelings?
Yeah, the med school was tough. It was tough. Especially because I was young, right? Like I kind of went in. I was the youngest, if not the second youngest person in med school, and
Wow.
because of this like accelerated path that I had set on, and
Right.
and I'm like sitting at these tables, we're having like group discussions, and I'm sitting with people that are like 10, 15 years older than me, that have lived lives, that have families, that have done a different career, that have now chosen medicine. Like, and I'm like, man, like, I haven't even looked up yet, right? Like, I have nothing to add. I had this constant feeling of like, I'm not good enough. I'm not as smart as them. I'm not, this. I'm not, it was this inferiority complex.
Mm.
Killer. It was brutal. Naturally, the fact is, you give respect and credit to where it's due, and I didn't have it at that time, but I was fortunate actually. You always want to be around places where you're maybe not the best, right? So that way you can grow into being the best. So
Right.
it's kind of you don't want to necessarily be the better than everyone else that you're hanging out with, because who are you kind of getting motivated by, etc. So it was kind of too much of the other extreme in my sense. There is kind of, the other issue is that you're always behind, right? There's just you can't learn all of medicine in 3 years. It's just not possible, and so you're always going to feel like I don't know enough. I don't know enough. I don't know enough. So now you couple that I'm not good enough with I don't know enough, and it's just getting worse, right? And so you're just like you're just putting in all this time of like trying to cram it in, even though it doesn't really help. I'm saying this because this is the reality, and no matter how you go about it, I think that they design it for you to be able to learn and absorb as much as possible.
Right.
And if you didn't have these sensations of feeling like you're always behind, where they're constantly bombarding you with, then when are you going to learn on a patient? No, you don't want to do that. You want to learn when you're supposed to learn, and
Absolutely.
that's where this is why the training is important to be that way. So, these are the challenges with that. But I was so lucky, actually. My setup was perfect because my brother was going to college at doing engineering in Hamilton, and I was going to med school in Hamilton. So we both rented a condo and stayed at the same place.
Lovely.
So yeah, we got to like reconnect. In high school you have your own friends, you got your own friends, and now we got to reconnect after like post grad, right? And that was special, right? To be able to kind of make a new relationship as adult friends and brothers at the same time. That was amazing to come home to that supportive, positive environment again. So key, so key. This is where, like, they say, like, you stand on the shoulder of giants, it takes a village to raise a child. Like, I understand that, because if you don't have that security and peace at home, it's a challenge, and we have to find places for that, and we have to use our network to channel that. We have to cut off, unfortunately, people that are negative or that do impair our ability to grow or to move forward. And those are tough things to do at a young age, but it's so critical. And anyhow, and then the last thing was that I actually I grew up in a environment where my mom always prayed and was always talking about Islam, but I didn't understand it. It was just kind of more of a ritual and physical um, understanding of religion until like one day in med school, like a friend, someone I was studying with was like, "Oh, it's time to pray. I'm gonna go. You come in to pray, right?" And like instantly, the guilt kicked in. I was like, "Yeah, yeah, of course, of course." As if like my mom asked me.
Of course.
Yeah. Like I'm not gonna admit that I don't pray.
Yeah.
So then I went and I prayed, and it's all in Arabic, and I had learned it, but I never learned the meanings of it, and I was just like, oh, like I came back, and instead of studying, I went on Google, and I'm like, what does this mean? What does this mean? And then I'm translating all the things that I was saying in my prayer, and I'm like, why was I saying like glory be to God? Why was I saying all praises due to God? Like, why am I saying that?
Hmm.
Right? And it was just like, anyhow, that was like the seed that kind of bloomed at that moment in med school that introduced God into my life,
Right.
into real and again the miracle of me being in med school and all of this um, it became a massively important support structure that I was able to endure and improve and it's like all these self-help books like religion and Islam was like my source of becoming the best version of myself because there is so much attention paid to your thoughts, your conscious, your moral compass, all
Right.
of these while I'm trying to learn about how to apply my values onto my patients. So it was just a perfect marriage
Right.
of science and art and spirituality that got me so intrigued, and that it didn't feel like work. That was my meditation. That was my spiritual cleansing and purification and all of that growth. So these are just words I'm throwing out there, but just like the ideas that come from treading that path. And so med school was the beginning of that, and I'm fortunate that was like my classmate asked me, "You're gonna pray, right?"
Hey, that's sometimes how it starts, I mean, I'm not Muslim myself, but I'm Christian, and sometimes these little things or what we think are little gestures are so big and critical for us and bring us back to our faith. So that's awesome,
Mm.
man. But what you described kind of leads me into my next question, which is essentially like throughout med school and even now, with your shift work, how do you how did you and how do you kind of alleviate some of that stress? I mean, I'm sure your faith helps a lot, you pray and everything like that, but outside of that, how do you manage your stress, not only in med school, but now while you're a working physician?
This is a great question. It's a question that every human on Earth does, did, and will always struggle with. Right?
Absolutely.
Um, we have so many cups in our lives. Right? We got your cup of family,
Yeah,
right? And that cup you want to keep full. You got your cup with friends. You want to keep that full. You
of
got your
course.
work cup. You got to find meaning and joy at work, not just for the bills, to pay the bills, to earn, to
Of
go on
course.
vacation, but for your life craft. Um, then you got your health, your yourself, your well-being cup.
Yeah,
That like your exercise, your sleep, your diet, your whatever other things related to your health. Faith probably goes in there, and then you have your like this like this other cup of it's often neglected, but it's like this community service piece, the part that you do not for yourself, but ultimately it helps you more than you give. So that
absolutely.
volunteering community piece. So we have all of these, and whether these are cups or balls, let's call them like juggling balls. And so at any one time, we humans think that we can juggle all of these things perfectly, and that's where the fallacy in that is, in my opinion. It's impossible
Right.
to juggle all of these perfectly. And so that's why I like the cup analogy is that each cup has kind of a hole at the bottom, and your job is to keep filling the cup. But don't stay too long in one cup, and don't ignore another cup too long. And so I kind of organized my life like that to be like, okay, I'm not feeling too good right now. Why is that? And if I kind of revisit these cups, one of them is empty.
Right.
And these are the things that are important to me. So, when I say like my health and my exercise, so it may be that I'm doing great with work and my family and I'm volunteering and my friends, but I haven't worked out, I haven't played ball, and like I just don't feel that excitement, the happiness. It's like, oh, it's literally the fact that I didn't play ball this last 2-3 weeks because I was busy with so and so and so.
Right.
So it's just kind of identifying what's a priority to you. So like I said, if I don't play, like you were saying, if I don't play basketball, I am not me. Like it's simple as that, right? And it's like my identity, and we all have to recognize and identify. Some people can be like, if I don't paint, if I don't play music, if I don't dance, if, I'm not me. Okay, you've identified something very important. Never let go of that, because when those dark days come, and they'll come for all of us, that's the first thing for some reason we let go because we think it's extra or we think it's a waste of time or it's not a priority.
Right.
But it's quite the opposite. It's the priority. It's the priority. It's the same thing that's often the thing that makes you feel like, hey, you have an exam tomorrow. Why are you playing basketball? It's like, I need this to pass my exam.
Yeah.
I need this to study for my exam.
Right.
It's an investment in yourself, and all of these things are that. And one thing I just want to say, which was transformational for me, was that when faith came in and I was able to see the world through that lens, it changed. Like faith wasn't like under the subheading of health and per self-care. It went all the way to the top, meaning my life, you put on these glasses, they were my faith glasses, the lens of viewing the world through my moral compass.
Yeah.
So seeing how I was making decisions with my family. So whatever is pleasing to God was the way that I would be with my family. How I was earning my income, whatever was pleasing to God is the way that I was earning my income. Whatever was pleasing to God is the way that I was expressing my health and friends, etc. So it kind of helped to again marry the spiritual faith, which is kind of it's all encompassing. Really, it's not just one cup, right? It's all encompassing, and it helped me to detach from personal things. And I think this is why I bring this up, is that helped me detach from saying things like, Junior, my basketball, my car. Instantly those things change to the basketball and the car. And it's like, if it gets a scratch, oh, my car got scratched. No, I don't have that attachment anymore. The car got attached. It's the car. It serves me. I don't serve it.
That's right.
And so anyhow, these little things, they're nuances, but they actually help reduce so much stress, unnecessary baggage and burden that we carry for things that really don't mean much. And so anyhow, that's why I wanted to kind of add that piece in there. Does that answer the question?
It absolutely does, man. That's
appreciate
beautiful.
You sharing that. That's deep.
Yeah, that was actually really beautiful. But also, I think the idea of the cup that you were sharing as well, kind of for me, like I think managing things around my life are, I wouldn't say a problem, but can be a problem for sure. And I think at times I definitely live in that fallacy that I could water every cup. I can manage everything, And then at times, like you said, there is something that will cost the price of trying to do that. And so you kind of saying that just reminded me kind of like there is a path and I need to focus and water the cups that need to be watered,
Yeah. I encourage everyone to figure out what those cups are for them. Right? These are my cups, and and so that takes a little bit of work, but not too much, because the things that are important to you are top of mind anyway. So it's just figuring that out.
Oh, that's nice, man. I like the way you put it together. Though it was really nice. That
was a great analogy. I love that. You kind of answered the next two questions, so we'll skip over to this next one right here. How has emergency medicine evolved since you started, and what changes do you see coming in the future?
Yeah, so healthcare in general, it's ripe for innovation, as we know, right? Like
Of
so
course.
much things, like it's like so far behind in terms of the technology and innovations compared to other areas. Since I started, ultrasound was in the beginning days when I started, and now it's kind of like I see nurses doing IV guided peripheral ultrasound guided peripheral IVs, which I love. I love seeing that, and we're often doing like sepsis care, and we're giving a ton of fluids, and we don't know if 90-year-old lady can handle another 2 liters or what, and so we've
Yeah.
got like lung ultrasound and IVC ultrasound to assess for um, how where the fluid's going. Are they still volume deplete or is it filling up in the lungs? So it's just incredible hemodynamic assessments that ultrasound gives you that nothing else does. I get the answers before my blood test and my imaging come back. That kind of technology, especially with now there's this Butterfly IQ, it's called. It literally connects to the iPhone or other phones, and you have an ultrasound on your phone wherever you're going. Like it's quite remarkable. I actually had a neighbor that was having heart failure and he was complaining of shortness of breath, and like I just went over to the house and kind of did an assessment. The ultrasound gave me the answer. I was able to counsel them, advise them. Still
Hold
they
on.
don't
I'm
understand well.
sorry to cut you off,
Yeah,
Hanzla. What did you just say? You
yeah.
have an ultrasound on your phone?
Yeah, this is what's amazing about this new technology. You literally plug it in like you plug in your charger. You
Right.
plug in the ultrasound into it. You open up the app, and now your phone becomes the ultrasound screen.
Holy crap.
And and then you use the probe, and that probe is kind of a one size fit all type of probe. So you can check your heart, you can check the lungs, you can, check the eyes, you can check the veins. It's
Wow, that's incredible.
pregnancies. Yeah, exactly. And the cost has become amazingly less. And this is what technology, it just reduces cost. Innovation reduces cost. So initially, ultrasound, those big machines, hundreds of thousands, if not, and now they've come down to just around 100,000. And this one, the point of care, the one in your hand, you can purchase for approximately $2,000 to $4,000, which is a significant drop in the price now,
Absolutely.
considering if you're in a low resource setting, they can't afford the $100,000 machine. At least they can start with this. So ultrasound's been a game changer, especially in emergency medicine. Like um, I can there were times where I made diagnosis about patients that came in with shortness of breath. I would say COPD exacerbation slash pneumonia slash CHF.
Right.
It's like, which one is it?
Yeah,
Because they're
yeah.
kind of all treated a little differently, and now when I think about that, I'm like embarrassed. I'm embarrassed because I the triple diagnosis is no longer a possibility with having an ultrasound
Right.
because you will know if they're volume overloaded, CHF, or volume deplete,
Right.
probably pneumonia or COPD, right? And so it's now it's just maybe one or two of those diagnoses at max, but it's when you can see how the heart's pumping, it's strong, vigorous contractions. You're not really worried about heart failure. You're like, okay, let's give the person fluids.
Right.
Even if you have no background history of that. So um, that's one thing. Second thing is like, AI is it's over the last like year has really it took the world by storm, right? Personally,
Absolutely.
like
Yep.
I've stopped using Google, right? Like I've honestly I don't remember now the last time I used Google for anything. It's ChatGPT everything,
Yeah.
and and there's other ones too. Like obviously that's just the one that I'm comfortable with. But I on shift now, like there's Up to Date as a great resource on shift just for my own learning. I'll often be like, give me the differential diagnosis of someone with hypocalcemia and tell me all the investigations for that.
Yeah.
I would normally just ignore this. I wouldn't even learn about it. But now that I know that I don't have to spend a lot of time reading through long articles,
Absolutely.
yeah, it's giving me a pinpoint like, oh, it could be this disease, this disease, this disease. You should order this ultrasound, this blood test, etc. I'm like, oh, good to know. Anyways, move on. Right? It's not really
Absolutely.
relevant to my emergency, but I've just added. Technology has removed the barrier to learning, and so whether it's like, hey, you can upload a picture of something, right? Like, why does this what does this ECG say, or why is it reporting so and so? And just to kind of add to our education. Education has become easier, and that's such a thing that I'm so excited about.
Man, that's actually incredible. I feel like in this short conversation, I've learned so much about how things have changed and how things are moving. Would you, if any, are there any, I guess, misconceptions about like emergency medicine that you think would ever have to be cleared up?
You know, I think the big one is the name, right? People come to I can't. It's really innumerable how many times I've heard like a patient or a family member will say, "I came to the emergency. I thought that would be seen in an emergent fashion."
Right.
Right, and unfortunately the public awareness about how what we call the CTAS system, right, the triage system,
Right.
where our nurses are amazing. They are so gifted, so. I can't believe how on point they are, day in and day out with these things. That makes our jobs easier and allows us to trust. If this person's a 3, they're a 3. If this person's a 1, they're a 1. Right? There's a big difference there, a world of a difference there. And it allows us to kind of just focus on those things. They've made those decisions for us and filtered those out so we can just continue to just be efficient with seeing the next one. So the misconception is that the emergency department is where you're going to be seen right away because every problem you come in with is an emergency.
Right.
That's a misconception.
Absolutely.
I think the people on this podcast probably know that already. However, that's one thing that we struggle with because we have to be in the role where we have to educate. And so though we are like, why don't you know this? We're ultimately still in a customer service industry.
Absolutely.
Where we have to get out of our heads and realize that this is new for them, and so explain it to them in a way that's not condescending or insulting or demeaning to them, because their health problem or their loved one is the most important one. It doesn't matter,
right?
And telling them otherwise is not going to help solve this problem that they're raising to you.
Of course.
So that's one of the things, is that a lot of effort goes in towards education, not just about emergency room use, but education in terms of health. And so we're not just saving lives, doing CPR, intubating, and etc., critical care, but we're doing, someone comes in with the first day of fever and a 2-year-old, and it's like, okay, let me tell you how this is going to work now, since your child just started daycare for the next 5 years, right?
Yeah.
It's like you're going to deal with this every 3 months or every month. It's going to feel like they never not have a fever, and so this is how you treat fevers. This is what you focus on: hydration, wet diapers. This is when you come back to emerge. The work of breathing. They're not drinking.
Right.
Their energy level, and so it's kind of that's such a day-to-day piece of it, and then what you're trying to do is prevent. And that's where your discharge instructions are not just like a handout here, read this 20 things and come back. It's like, no, 1, 2, this is what we want to prevent.
Yeah.
Or, hey, I need to exercise. I can't emphasize it to you. You need to, you're at risk of heart disease, etc. So I don't want to see you as emerge, right? I don't want to see you as a real emergency in the future. So
exactly.
It's kind of like addressing factors like that, where it's I do my job for probably the 2 to 5% of the patients that I truly love to do this specialty for.
Right.
But the 95% of patients that I see, you still have to take pleasure and enjoyment in the kind of work that you and the care that you deliver to them. And that's the 95% is not the 5% that we get the attention for in terms of emergency care.
Absolutely.
Wow. Okay. The next question that I wanted to ask you, Hanzla, it's a 2-part question actually. The pandemic. So you've been a doctor in the Emerge for about 10 years. How did the pandemic affect you and the emergency room where you were located?
Yeah, so we were in a hotspot. We had a lot of deaths. This is the thing. Like in The pandemic was basically at my 7 year mark,
Right.
6, 7 year mark. So I was kind of feeling comfortable at this point in time. But in the 6, 7 years, the amount of deaths that we experienced, like all staff and all staff, was just unbelievable. Right? Like I hadn't seen that cumulatively in my 6, 7 years up until that stage. The amount of like disease burdens where like you walk into a room and someone is satting like 84% on room air and there's no monitor, they're not on oxygen yet. It's just like that's sort of a norm in some waves. Initially, the second wave and Omicron, I forget the name, Omicron or anyhow.
Oh yeah, there's Delta, Omicron.
PTSD. Yeah. Trying to erase that.
Your brain doesn't want you to remember what it was.
Yeah, exactly. So, there was you realize, this is the thing, you realize a lot of how healthcare challenges, policy challenges, how politics really influence and affect and can sometimes negatively affect these things and how everything is related. And I was able to really see a lot more of the factors that played beyond just like take care of patients, right? It wasn't as simple as that. It's frustrating because we, being on the front lines, had the finger on the pulse better than anyone else. But by the time the data and the information would get fed back to decision makers, there was this lag that felt so painful. Like for example, from day one, I believed and I advocated for my nurses to have N95s when patients were coming in coughing. I'm like, they are aerosolizing, like the nurses are in their face doing blood work. Like, I can stand at the door, look at them, do orders. I don't need an N95, but and the rule was no, they just wear a regular face mask.
Yeah.
Because there's no evidence for that at this point, right? And it's like, I don't need evidence. Like they are like hacking and coughing.
It's common sense.
Like, yeah, exactly. And so we sort of unfortunately gave into groupthink and didn't use common sense first and foremost, and went so far into this resource allocation and using these terms and as if and again, the decision makers that were making them didn't have skin in the game.
Right.
They didn't have their loved ones drawing blood necessarily. They might have, but it's often and so. For me, I was taking my N95s I was giving it to the nurses. I'm not saying like I'm some sort of hero. I'm just saying that's how hard it was being on the front lines and experiencing the lag between the policy changes that are too late or too slow. And so that was definitely one of the struggles of and realizations of realizing how complex the healthcare system is beyond just I'm the doctor, this is a nurse, and we're going to take care of you. We're going to do whatever we need to do. What's best for you. It's kind of more complicated than that, and helping to be more interested in advocating, kind of over the longer picture, because the problems that we have today are not going to get fixed today, but we can prevent them for tomorrow. And if we all sort of have that idea rather than just complain about it and be frustrated about it, we can hopefully, build on this healthcare system and improve it, because what else are we going to do, right? Just complain and let it evolve when we're the best advocates for it, because we know it. We have the finger on the pulse better than anyone else.
Yeah, that's right. So with the experience that you've acquired now, and now that obviously we're pretty clear from the pandemic, have you ever considered doing some traveling and kind of as an emergency doc and either working or educating in different countries?
Yeah, so global health has been that's been a dream from day one, right? Like when you want to be, when I wanted to become a doctor, I was like, oh man, I'd love to work in anywhere in the world, right? Especially in really, really poor, under-resourced, places where they don't have normal healthcare, whatever that meant, right? Like that's like just kind of this blanket statement. And when I was growing up, World Vision was like advertising all the time. They were showing kids in Africa. They had inflated abdomens from malnutrition. I was like, oh man, like I want to go there, right? Like it was just that was just what was at that time front of mind, top of mind, front of face sort of thing. Um, the thing has been up until now, I've been struggling with a lot of missions where it's like you go and you kind of diagnose with the problem and you give them a prescription, but then they can't afford it, and it just feels like you're not making any real difference.
Right.
And for me, sustainability of efforts and is such an important thing that it's almost, I don't know if it's been an excuse that I've avoided doing it, saying, "Oh, that's not sustainable. That's not sustainable. I want to do something sustainable." So um, what I've realized though has been that education is sustainable, right?
Mm-hmm.
Even if you educate one person, then that's something that they may educate another, and so on. And you've got a really good pyramid scheme going there.
Yeah, it's like the
And
each one
so,
teach one
Mm-hmm.
type thought. Type.
exactly,
Yeah.
exactly. So at this moment, I have an opportunity to travel to Pakistan. I was born there, but I'm not really cultured as far as how Pakistan is. But my parents, I'm kind of a hybrid between having the home culture from Pakistan, Canadian culture as far as my upbringing.
Yeah.
Amazing that I can speak the language, and so it's just a perfect opportunity to be able to go into rural villages there where I can connect with the local people, and bring my education experience there. And so I'm planning on actually doing some educational events with the local teaching college, the local hospital, working with some of the local doctors who actually handle emergencies. In fact, emergency medicine as a specialty is a new specialty relative to others.
Yeah.
And still in many parts of the world, they kind of are rotating doctors, or there may be these staff called medical officers that are just the sort of med school graduates,
Mm-hmm.
but not necessarily specialists in any particular field that address emergencies. And we know that if the emergency handled well can really save a life. And
Absolutely.
so the way that I see treating the social determinants of health, treating um, have to taking care of orphans and widows and families that don't have any earners. The way that I see it is, instead of giving them a handout, how about we prevent it
Yeah.
with good health care?
Mm-hmm.
How about we save the mom from dying after giving birth to a child? How about we, provide timely access to cardiac care or heart attack care or stroke care to the dad that's the single earner in the family? What if we improve the healthcare that may prevent all these needs that are coming in these, like, really, really um, struggling communities? And so that's sort of an avenue that I've identified. I did some training and teaching through simulation, and so planning on applying some of the simulation-based scenarios as a launching pad to discuss common things, to kind of understand their needs and to kind of build on it. Obviously, the needs and the norms are probably very different in Canada. This will be my first venture out there, and so I'm hoping to learn a lot and hopefully contribute a little, as much as I can. And we'll see where that takes me. That's one. And that's international. But one of the other things is, even within national boundaries, is that I worked rurally in sort of northern Ontario, indigenous populations there. Different types of health problems. Like, for example, I had a young man that came in with chest pain. I'm like, "Oh, so like what happened?" He says, "Oh, I was pulling a moose out of the ditch." It's not a story we hear in the city, right?
Yeah,
Like,
Right.
and
that doesn't happen every day here, you know?
yeah, and I'm like, yeah, that's a serious pulled muscle, man. Like, it's different than as picking up a bag of milk,
Yeah,
right? Like
absolutely.
Definitely.
moose. So, and then you realize, again, different. You come into different places with these, like, unconscious biases. You think that things are going to be this way, and the people will be this way, and then you realize that we are so deluded, really, right? That we
Absolutely.
truly just have such a small understanding of things, and it's only through our experiences that we can really broaden our understanding. And that's where I was able to realize that the population, indigenous population, was actually remarkable. I learned. I had very, very positive experiences with them, and serving them, and just seeing their gratitude, their appreciation. The appreciation really stuck out compared to the amount of appreciation we received in the GTA. And that was again an opportunity to work in settings that is not the same as the urban settings where you get access to everything, timely access, um, and without having to go to a different country. Emergency medicine gives you that ability to kind of pick up your bag and say, okay, I want to practice here.
Yeah,
And
right.
I want to practice here. And you literally have the same skill set. You don't need an operating room. You don't need operating equipment necessarily. It's pretty kind of standard, clinical setup. So, which is what makes the specialty so, limitless in terms of its potential impact and benefits and what each individual can bring to it
Yeah.
and can bring to the patients that they serve.
That's interesting. So, are you saying that you have gone up north and worked emergency medicine for a couple of weeks or months, or
Yeah, yeah. So my parents actually, my dad, he built a place up in Timmins, Ontario, which is like 7, 8
Timmins?
hour drive. Yeah,
I'm very
exactly.
familiar.
Oh
Way,
yeah,
way up north.
yeah.
Actually, in my first year of nursing school, he wasn't a nurse, but I lived on residence, and I had a friend who actually is from Timmins.
Yeah.
Whole different environment. I had to Google it, and
Mm,
I'm like, wow, this is Timmins.
yeah,
But yeah, sorry to cut you off. Go on. Yeah, Timmins, very small
yeah.
population.
So, yeah, my dad wanted that country life. He bought some land in the bush, and he'd be sending me like pictures of the Canadian lynx and the family of five, snow fox, snow hares, and moose, all in and black bears, all in his backyard. This is
Oh
all in his
man.
backyard. It's remarkable, yeah. So when I visit them, I had got some privileges at the hospital there, and so I was able to kind of to experience to get a real feel of the community pulse as well, and
Right.
so that was how I was able to kind of bridge the rural experience with family. It's kind of that cup piece that I was talking about. It's like I want to see them, but I don't want to be away from work for too long. How can I kind of make both happen? And that's how that came together.
What were some of the challenges that you faced or that you noticed working in Timmins as an emergency doctor, whether it be like education in comparison to where you originally worked, or medication compliancy? Were there certain things that you noticed that were far more challenging compared to where you currently work now?
Yeah, that's a good question. Resources, right? Then we could kind of throw that word out there, and
Yeah,
then
right.
I don't even know what it means really, right? But it's like resources, and
Right.
it's once you work in these places that don't have it, it's like not having something. You realize what you have, right?
Mm,
You take my eyes away. I realize the resource of my eyes
Right.
now, right? And so it's amazing. It's interesting how we learn and realize things that way, and it's so the community support and help. So these patients that are not well, like if they're disabled or they're wheelchair bound, they they just really have had a hard time with a lot of their wound care, their foot care, diabetes care, their chronic health and disease management. So chronic disease needs a lot of attention to improve outcomes. And I found that that was not as optimal as here, where you've got all sorts of specialty clinics that will kind of follow up on them, and home care nursing, and um, so that would really help to uplift some of these outcomes that we have in the community that we didn't have there. Secondly, it was finances. You can diagnose someone and say that you need these antibiotics for your dog bite, and they said, well, we'll just see if it gets really infected, and then I'll
Oh
come back for
no.
some IV antibiotics because I can't afford them. I'm like, but it's in your hand.
Yeah.
That's not a good thing to get your hand infected. It's like, well, I can't afford it.
Yeah.
It's like, yeah, okay. Like, it's, like, do you have a social worker? No. You have Ontario Works? What's that? It's like, oh my goodness. It's like, these are community programs and things that, if someone was there, can kind of connect you with and kind of give you some sort of grounding. Or what about your housing situation? Huh? What
Yeah.
do you mean? There's housing? It's like, it's at least in GTA we feel like they're not being served well. But when you go to those environments, you realize that we're abundant
Oh, for sure.
relatively. Um,
So do you
yeah, I
feel
think those
like,
are the primary things. Yeah.
sorry to interrupt you, do you feel like when you go to these rural communities and you work, that in a sense it sharpens you almost as a physician, because now you are the social worker. Now you are like, you wear more than just one hat because these communities may not have these resources.
That's an excellent point and observation. Actually, I didn't click to me that way, but you're absolutely right. You are to be a patient advocate, to be patient centered. You would naturally find ways, or want to find ways and solutions, or advocate for solutions, uh, any which way. And you're right. And so this is the thing about like working emergency medicine in a community setting versus in an academic setting, where you'll have a lot more learners, a lot more subspecialty staff that may be involved in taking care of patients, compared to in a community where you, as an emergency physician or nurse, are kind of handling it mostly on your own.
Yeah.
Though the support is there. So you're absolutely right. Like the staff often bridges that gap by putting on more hats than they're accustomed to in different environments.
Well, so this is kind of sidetracking us back to a previous question where we touched upon the pandemic. Advocacy in the emergency. You mentioned how there was a situation where some of the nurses, they were getting up close to patients, the hacking coughs, they weren't wearing N95s. Do you find that in the emergency setting, do you find that physicians or doctors, their voices, does it really matter to the upper to management? And
You're gonna get me in trouble.
because to me, I feel as if, like, as doctors, you guys are the quarterbacks.
Yeah, yeah,
You
for
know what I
sure.
mean? You guys are whatever you guys advocate or say, the
Pulls
upper,
away.
yeah, it has to matter. It has to say something to,
Because at least, and maybe you don't have to answer the question if
right.
you feel like it might get you in trouble. I feel like, for me, at least as a nurse, if I have something I think could be valuable to our unit or the team or anything, that the voice isn't heard as well as it should be, and it doesn't pull the weight I feel like it should. You know what I mean? And if
Yeah.
there was like we've had situations where, let's say, a physician will agree, and then all of a sudden things start moving. You know what I mean? But I mean, I'm sure you have your own situations where you feel like things could be implemented, and then I wonder how difficult it is
Yeah.
for those things to be implemented
Yeah.
from your side of things.
Um, it's unfortunate what you said about, a nurse noticed something, says something, nothing happens. Physician gets on board. All right, we're moving now.
Yeah.
That's ridiculous. It's ridiculous. It's the, the problem is not in my hospital or your hospital. The problem is in um, in the corporate governance of organization, in
Right.
the way an organization is designed to run. Like, you see how I don't know if you're familiar with you probably are. Sorry. Jeff Bezos, like his annual letter to his staff.
Right.
It was like it's every day is day one, right? Like, it
Exactly.
was just this like um, just this attitude, and then all of these successful companies, like the Toyota Motor Company, for example, they had this model where anyone on the assembly line can pull the emergency stop, so to speak, to say we have a problem. Everyone stops what they're doing. They come around, they troubleshoot, and they fix the problem once and for all.
Right.
Once and for all.
Right.
Who has the power? The person that's just manning the line.
Right.
That's not a doctor. That's not like they don't have a title. They're just sort of a cog in the wheel. They're a part of the whole
That's
wheel.
exactly right.
Every part matters.
That's
Every
right.
part matters. And so the systems that are designed to take advantage of this valuable insight, experience, and advice and advocacy of the frontline staff, the systems that are designed to take that in, to say, yes, thank you for this. Let's do this. Can you help make this happen? And
Right.
then to empower and to encourage and to reduce the red tape and to reduce the administration and the policy and to create organizations that are designed that way to do that is where the problem is. Like companies like, for example, like Virgin Mobile, Richard Branson, he told all of his customer service agents that if any customer calls and is complaining about a problem that is less than $100, you do not need to ask permission from anyone. You have my permission to take care of that problem.
Yeah.
$100 across the board, right? So how many times we call and we're just trying to get like a $30 refund, $40 refund, and it's just like, so much headache.
Right.
And it's just like, no, treat the customer. It's the same thing as that the design, and at least in Canada, it's a public system. It's top down, not from the bottom up.
That's right.
It's not so innovative in terms of like piloting, trying things, failing, learning. Let's go again. It's like they have this approach where everything needs to be perfect from the get go, and which is kind of makes it very slow, makes it not very innovative, minimizes experimentation. I hope that that's something that evolves and that changes. I do believe, like you said, that everyone has a role in advocacy. I do not want to discourage any staff, any person in general to ever advocate, because it is ridiculous to need a title to advocate. It's about the idea. It's not
Right.
about the title. It's about the idea that matters.
That's right.
And even if it's physicians, if the organization is not set up to improve quality through either taking these ideas seriously, not just for the sake of avoiding lawsuits, because that's their incentive, but for the sake of improving patient outcomes. Now that's something admirable, and that's something that I would encourage people to get behind those organizations. Those are the organizations that deserve your attention, your energy, your work, your effort, your ideas. Now, where are those organizations? Let me know.
Yeah, seriously. You let me know when you find out.
I think we have 2 more questions left, if I'm not mistaken. Can you share a story from the ER that has stuck with you over the years? Obviously, maintain confidentiality, but any funny stories or crazy stories that you've seen in the ER, essentially.
This is the question I'm gonna have to ask to the script. It's for me. This is challenging. My approach to the way that I remember and I see patients in the emerge. It's not the way that oftentimes at a dinner or a party, someone will be like, "Oh, tell me something crazy what happened in the emerge," and the only part that I find crazy is the medical challenging aspects of it. I don't like to make judgments about the social aspects of it, about
right.
patients' decision making, about their struggles. I don't want to laugh at them. I don't want to, entertain myself or others on their expense. So, and each experience is so like it's kind of it's teaching experience, and I like to kind of keep that kind of a sacred thing rather than. And so it becomes a hard thing for me to kind of also to limit it to memorable emerge stories. So if I could just skip this one, I'd appreciate it.
No problem.
Oh, absolutely. My last question is, if you could talk to yourself, let's say in high school or maybe early uni days or even early med school days, and you could give yourself some advice for the future, what would it be?
Yeah, this is good. I think what's important for my 18-year-old self, and I think for a lot of young people, it's 2 things actually. One is that I would want to not just say, I would not just emphasize, but to help them to truly believe that they're good enough.
Yeah.
Like I was saying with all these experiences through school,
Yeah.
is that you're constantly reminded that you're not as good, or you're behind, or you're not smart enough,
Yeah.
right? It's that it's for them to truly believe that their efforts, their brains, their ideas are valid, they're good enough. Just the fact that they are willing and trying is enough, right? Like, I mean, that foundation to start from, to build from, is so 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 essential, because the opposite of that is so destructive, so unproductive, so wasteful.
Mm.
And so it removes a lot of wasted energy, let's put it. And to balance that foundation of that, you as a human, you as a person, you as someone that wants something, are good enough, period.
Yeah.
Don't let even your inner voice tell you otherwise. In fact, turn that inner voice into your ally, not your
Absolutely.
biggest critic.
Absolutely.
On top of that is the second most important thing to myself and to anyone else would be, get better every day.
Beautiful.
They they say compounding is like one of the greatest miracles. If you really look at how numbers, for example, if you take one and you double it, that's
Mm.
two. Double it, 4, 8, 16. But then if you kind of do that for just a little bit longer,
Mm.
you get into these astronomical numbers.
Absolutely.
And initially it's just like, oh, it's just 1, 2, 4, 8, 16. It's not a big deal. But then it's like 32, 64, 128, 256, 512. It's like it's just flying now. The
Right.
absolute increases are just tremendous. And that's the same thing with compounded gains in terms of knowledge, in terms of self care, in terms of exercise, in terms of weight loss, in terms of nutrition, in terms of spirituality, in terms of um, your craft, improving on your work. Like if one day you're working on your dribbles, your left hand dribbles, okay,
Mm.
and the next day you're working on your left hand layup. Next day you're working on your left hand, behind your back pass. It's like every day, if you just keep on adding, you're like, oh, I spent 3 hours just dribbling with my left hand today, but you add that, if you just continue to do that 365 days, if you had 365, boot camps of drills that you did in basketball,
Right.
with this focus that, I don't need to be better at everything. I just need to be better at one thing today. And you just apply it to whatever you're doing and to everything you're doing in life, and to really commit to that growth mindset. Really, it's very, very important to have that growth mindset. It allows you to be flexible to whatever life throws at you, to adapt to changes that you may not agree with, to adapt to changes that no one could have ever predicted, whether positive or even negative.
Right.
So you're good enough, get better every day, and just stick with that. Repeat.
Wow. Hanzla,
Yeah.
appreciate
I
you
got
got
one more actually. I thought of one more question, Hansla. And honestly,
All right.
admittedly, I actually wouldn't even know how to answer this question. We've touched a little bit on
Okay.
faith, obviously, through this episode. How do you feel like your faith has made you a better physician?
Oof, bro. My faith has changed my life and made me a better human. Made me a better human. Better physician is just a small, tiny part of it. Physician is a tiny part of
Right.
what it means to be a better human. But I will apply it directly to that. So, um, let me tell you a story then, okay? Well,
Yeah.
I'll come back to answer that memorable emerge story through this question.
There you go.
So I was taking a patient. I took care of a lady in the hallway, an elderly lady, and she could. I wanted to examine her, so I was sitting her up and lying her down, and of course I was helping her with doing that. After I was done, I hear her talking to the daughter talking to the nurse. Oh my God, that doctor's like an angel. Okay, all right, I'm feeling good. I'm feeling good. I'm an angel, huh?
Yeah.
so so my shift ends. My shift ends, and remember, there's always loud noises, people screaming, blah blah blah. There was a
Absolutely.
code white recently, actually overhead just before that. I'm just sitting, I'm documenting on the last patient. I'm about to actually head out,
Yeah.
and I hear this guy yelling, "Get the effing doctor here right now! Get the effing doctor here right now! You don't know who I am. One call, you're all dead. Who the f are you?" Like he's just going off. Like
Yeah.
he's just going off so like aggressive.
Yeah.
I'm just like, I'm just out of like not even being a doctor. I'm just like curious to see this guy's face.
Of course.
I just walk by. I walk by in the room. I have my badge on, everything, right? And he's like, "You come here. Go get the effing doctor right now. Go get the effing doctor. You know who I am? You're all dead. One phone call."
Yeah.
Right? And I was just like, and again, this is the same nurse that was that patient's daughter spoke to and said, "Oh, that doctor's an angel." So, anyways, I see this guy. He's restrained in one hand, the other hand he's got a cut because he was a code white because he punched the glass outside and broke it and cut his hand.
Oh man.
So he's intoxicated. He cut his hand. He's bleeding. He's restrained. He's a code white. He's aggressive, belligerent, etc. Okay. I just like kind of like smirk at him. I guess I don't remember. I walk away. I go home. I drive home. And then, my mind comes back to, "You're an angel, you're an angel." And I'm like, I'm like, "Oh yeah? So is that what an angel would do when someone is hurting?"
Right.
Just because a man is expressing his hurt that way,
Right.
whereas perhaps another man or a woman may express their hurt through tears or through isolation and seclusion, I would be happy to help them. But because this person's not hurting in the way that I want them to hurt,
Yeah.
I'm not going to help them. But what if I actually put my ego down and I said, "Hey, I'm sorry that you've had to wait all this time. Let me help take care of you right now. You know what? I'm going to take care of you. I'm sorry that you're going through." What if I basically unarmed him? I took away his weapons of whatever he was saying, and I met him where he was, right? And I said, "You know what? I've had bad days like this too. I don't blame you for feeling how you're feeling." I took away the judgment that he's been seeing in everyone's eyes. Now, how would he be tomorrow if I approached it that way today? And anyhow, my faith reminded me that, wish for your brother what you wish for yourself. We haven't lived a moment in each other's shoes, but we shouldn't pretend like we have either. We shouldn't be the judge. God is the judge. We all enjoy the benefits and blessings, countless blessings, and we know that, especially in healthcare. And like single process is a blessing, and so just recognizing that, witnessing that, and being fortunate to be on this side of the care equation where we're giving the care rather than in a need to receive it. My faith tells me that anytime I'm in the service of others, God is serving me, so to speak.
Yeah.
Is pleased with me, and so it's just all encompassing. With your tongue, with your thoughts, with your actions, and to constantly beat down that ego of pride, of greed, of status, of public opinion, and rather connect at a deeply human spiritual level. It's just that.
Thank you so much for being a guest today.
Yeah, thank you so much, man.
A lot of solid information that everyone can take away, honestly speaking.
Yeah.
So make sure y'all like, subscribe, comment, follow us on TikTok, Facebook, Instagram, all that. Let's get those subscribers up. Hanzla, once again, thank you so much.
Thank you so much, man.
Yeah.
I appreciate it. And Hanzla, I mean, you're not here to see it, but at the very end of the episode here, I have two sons. And they showed up. They woke up from their nap and they're here. So when you watch your episode, you'll see. I guess, and I didn't realize one's naked. So I don't know how that's going to translate on the YouTube. But
we might get banned. I don't know.
We'll have to edit. So I didn't realize until he was sitting beside me and I didn't know where he was naked. So we'll see how that goes.
Man, it's been a real privilege. I appreciate you guys asking these questions, giving me the opportunity to share some of this. Hopefully, it's a benefit to anyone. And again, I'm just happy for the privilege.
Yeah, man.
Thank you guys for doing what you're doing.
Yeah, man, and good luck on the trip to Pakistan. I'm really interested in hearing how things turn out and kind of what you learned from this experience, man.
Thank you.
Yeah, then hopefully we can hoop again, man. I need to get you back.
Yeah, I need to see that mid-range. So, Hanzla, I might be out next time you guys are hooping.
I look forward to that. You know where to find me.
Yes, sir. Yes, sir. All right, that's the episode. Right. We'll see y'all later.
Peace.